Over the last several weeks, Montanans have faced unprecedented challenges. Our way of life has changed rapidly. Like every state in the nation, our once thriving economy is ailing. We've lost family members, friends, and community members. I've said it before, and I'll say it again. In times of crisis, Montanans have pulled together. And this time has been no different. Back in March, we knew that if we did not act, there would be dire consequences. That's why on Thursday, March 12th, I declared a state of emergency before there was even one COVID-19 positive case in our state. Just a few days later, after the first confirmed cases, we made the decision to temporarily close our schools and allow for remote learning. Montana schools closed on the same day as schools in nearby states like Oregon, and before hotspot states like Washington, New York, and New Jersey. Additionally, we limited visitation to our nursing homes to better protect those most vulnerable to the disease. On March 20th, we announced the closure of higher risk businesses such as bars, restaurants, gyms, and movie theaters. We did that just one day before California. And on March 27th, Montana entered into the stay-at-home order before half of the states in our country did so, including Florida, Georgia, Virginia, and Maine, states that are red and states that are blue. We have been aggressively managing this virus. As a result of the actions that we have taken, we have among the lowest number of COVID-19 cases in the nation. And indeed, of all of the states, the lowest percentage of positive cases when compared to our population. Montana also has the lowest number of hospitalizations per capita in our nation. There are very few states in the country that can say that they've seen the number of positive cases decline over these past weeks. Montana can say that because together we made that decline in cases possible. We have flattened the curve and we've saved lives. I recognize that over the past 5 weeks, Montanans all across our state have made incredible sacrifices. We've gone to great lengths for our healthcare workers, our doctors, our nurses, our pharmacists, our pharmacy techs, our custodians, receptionists, and more. We've made these sacrifices for all the other frontline workers in this crisis, grocery store employees, emergency responders, childcare providers, and so many others. We've done so for those most vulnerable to severe illness from this disease, our grandparents and parents, or those with compromised immune systems. From the start of this pandemic, I've been incredibly inspired each and every day by Montanans and how Montanans have come together as a community, how Montanans have taken the directives seriously and gone to great lengths to keep our fellow Montanans healthy and safe. This has not been the result of the actions of a few, but rather the effort of all of us as Montanans. In so many ways, we have stood together in the face of this crisis. We've done it the Montana way, by taking care of our neighbors when things get tough. These collective actions have allowed us to get to where we are today. and that's to begin a phased reopening of the state. While there's reason for optimism, this is no time for celebration. I'm going to ask Montanans to continue to go to great lengths to protect one another, to continue looking out for our neighbors who need it most, and to continue to be vigilant in every step that we take. Because just as important as it was for us to act as a community beginning 5 weeks ago, that still holds true to this day and moving forward. Once we begin to reopen, we want to be able to stay open. Our personal responsibility to protect those around us, particularly those most vulnerable, remains just as important as any time during this pandemic. Rather than focus on what will be changing after this week, I'd like to first focus on what will not change. The phased reopening plan and guidance for impacted businesses can be found on the covid19.mt.gov website. We're still asking so much of individuals. We're asking for you to continue with hand washing and sanitizing. I'm asking that if you are at all symptomatic, call a provider to get tested. And without regard to those results, quarantine until you're feeling better. I'm asking all individuals to strongly consider using a non-medical face covering or mask when in public, especially in grocery stores or other places where social distancing isn't practical. We continue to ask all individuals to minimize non-essential travel and to watch out for each other, especially our most vulnerable Montanans. And we're still asking much of our older Montanans. The advice that I will give my parents is the same as when this emergency first arose. Even as we lift the statewide shelter at home or stay at home order, all vulnerable Montanans should continue to follow that stay at home directive. And we're asking much of employers. And in some respects, we're even asking more. We're asking employers to encourage telework whenever possible and whenever feasible with business operations. And when telework is not feasible, to accommodate alternate work schedules, such as shift work and staggered scheduling. I'm asking employers to monitor your workforce for indicative symptoms and don't allow workers with symptoms to come to the work site. And we're asking employers to continue minimizing non-essential and out-of-state travel. And as we start to take actions to relax some of the directives, it becomes a responsibility of our businesses to take measures to better protect their employees as well as their customers. Businesses need to develop and implement appropriate policies regarding protective equipment and temperature checks or symptom screening. They need to enforce strict social distancing protocols, such as closing common areas in the workplace, where people are more likely to congregate and interact. And businesses need to make special accommodations for workers of the vulnerable populations. And we're still asking much of our senior living and assisted living facilities. Visits to Montana's nursing homes will continue to be suspended, except for certain compassionate care situations. Those who do interact with residents and patients must ensure strict protocols regarding hygiene and protection, and to make sure that those protocols are followed. Our senior and assisted living facilities are the most vulnerable place for cluster outbreaks. And I can't imagine cannot imagine how hard it is for our legacy Montanans to be isolated as they have been. Realize that the steps we are taking are to keep you safe. Now, here's what will change. Starting this Sunday, the stay-at-home order will be lifted. Now, that doesn't mean it's time for the celebratory block party or big barbecue. All throughout this first phase, we are asking Montanans to avoid gathering in groups of 10 or more people in circumstances that do not readily allow for appropriate physical distancing. As of this Sunday, places of worship, if they so choose, can reopen for services with reduced capacity and where strict physical distancing protocols can be maintained between non-household members. Families can sit together, but for the safety of the parish or the congregation, there has to be sufficient room between families. Starting on Monday, next Monday, which is April 28th, Main Street and retail businesses can reopen their doors, but that doesn't mean that things should be just like they were before the virus. Just like we're now all accustomed and used to those markings on the floor of our grocery stores, retail stores must have capacity, and they have to set out limitations of physical distancing. The same as far as Monday, April 28th goes for personal care, like hairdressers. I recognize that it's impossible to provide 6 feet of social distancing for an extended period if you're getting a haircut or a tattoo. The guidelines that we're putting out today set forth ways to minimize that risk, and local health departments may well provide additional or other guidance. Other businesses where groups gather often without the ability to provide the necessary distance to minimize the spread of the virus will remain closed for now. That includes places like movie theaters, gyms, and other events where a large number of people might gather. And that's really about it for next week. As these businesses open, as more Montanans leave their homes, I'm asking all Montanans to continue to act like a loved one's life may well depend on your actions, because they do. Starting the following Monday, on May 4th, restaurants, coffee shops, breweries, distilleries, and bars can go from providing takeout to some in-establishment services. That doesn't mean things are back to normal, though. Restaurants can operate at most at half of the regular capacity. No more than 6 people can sit together, and there has to be plenty of space between tables. You won't be able to sit at the bar to drink, and all customers will have to be out of the establishment during this first phase by 11:30 p.m. Now, I've delayed the opening of restaurants, bars, and breweries for another 10 days from now at the request of those in public health, as well as after hearing from many of those businesses themselves. Our local public health departments need to help and need to be able to work with local businesses as they look to reopen. Businesses need the opportunity to call back staff, train them on a new way of doing business, and get their supplies ordered. Equally important, they need the time to get this right. They need to take the steps to ensure that their employees and customers can be safe and don't become the cause of a cluster, so that a month from now, I'm not standing before you saying that because the outbreak's spreading in restaurants and bars, we have to go back to takeout and delivery only. 2 weeks from today, on Wednesday, May 7th, I'm lifting the directive requiring that our schools be closed to in-classroom learning. That decision, as well as local control whether to resume classes or to continue with remote learning, will return to your locally elected school board. When I made the decision for statewide school closure, it wasn't without recognizing the significant impact upon our kids in every corner of this state. And I so appreciate the teachers, the administrators, the service staff, all school district staff, and the parents who have been doing their level best to serve Montana kids through what really is a challenging time. While we are all doing the best that we can during this public health crisis, I've yet to talk to a teacher that believes that our students are growing and gaining as they would were it not for COVID-19. And were it otherwise, there'd be little need for classroom time in community schools in the future. Schools, like every other larger assembly of Montanans, really do hold the potential for transmission of the virus. Yet we need to be thinking about how to minimize the risk of transmission and still serve our children how and where they need it most. COVID-19 will be with us, not just for the next several months, but we may well be facing these same issues next fall when school starts. Of the 439 positive cases reported in Montana since we got our first, only 12 have been aged 19 and under. We need to figure out how to best serve our children at a time when the virus is still present in our communities. In returning things to local control, just like every other facet of our social lives and our businesses, I'm not suggesting that things return to normal. Just as our teachers ask their students each and every day to unleash their creativity, I encourage local school boards, teachers, principals, and administrators to spend the next week or so considering how, not just why not. I've been told by local public health officials that one of the most frequent asked questions to them is about high school graduations. Again, it is up to the local school boards. Yet I would encourage you all to be creative in considering how you can honor your graduates while minimizing, not eliminating, the risk of the spread of the virus. Just as churches will be creatively exploring what this new normal might look like, local school districts can do the same. So to be clear, after May 7th, the decision to open or close schools will be a local one, driven by local school boards. And whatever the decision, districts will continue to receive state funding. Additionally, through this first phase, the travel quarantine will remain in effect. Out-of-state travelers and Montana residents arriving from another state or country to Montana for a non-work-related purpose will still need to undergo a 14-day self-quarantine. I recognize that our tourism industry is hurting. But as Montanans have worked so hard to stop the spread of this virus, this first phase of reopening isn't yet the time to allow others to come into our state. As I've said before, our new normal is going to look different. This virus isn't gone from Montana. So as we turn to support our Main Street businesses and get more families back to work during this time, as we should, we must also be sure to continue looking out for those around us and protecting everyone around us. You'll see that the document that we are releasing today, it contemplates then going to a second and a third phase. The first phase and every phase is designed in consultation with state and local public health, healthcare providers, businesses, and emergency response experts as we gradually begin to open up and return to some sense of normalcy. I'm not putting an expiration date on phase one. We'll be monitoring cases closely and carefully. We need to see how this first phase works for Montana in line with our continuing efforts to slow the spread of this virus. Moreover, depending on the circumstances of an individual community, local public health departments and tribal governments may well impose or continue restrictions greater than what I've set forth at the state level. I ask you to respect those local decisions. We have flattened the curve. And now as we move forward, we need to make sure that we keep the virus contained as best as possible. And as we reopen up things, there will likely be an increase in cases. However, just like before, for every person we take out of that chain of transmission, we can help prevent that spark that causes large outbreaks. In many ways, it's just like we've been doing before. Continued vigilance in adhering to social distancing, even at a retail store or at a restaurant or bar. From the start of this pandemic, the message from the federal government has been that this disaster is locally executed, state managed, and federally supported. In words and in actions, I've had more than my share of frustrations with the level or the lack of federal support. As we enter phase one, this is not the time for political posturing or declaring victory. And we're not in the clear yet. We're still relying on support from the federal government to get through this. Certainly keep fighting for and securing personal protective equipment for our first responders and the supplies to ramp up our testing capacity further. Just yesterday, I'd announced that we were able to secure hundreds of thousands of face masks, shields, and gloves from private market distributors. Additional supply orders are pending outside of the normal supply chains and outside of any chains of the federal government. Additionally, we'll be working all along the way to ramp up even further our testing capacity. On Monday of this week, after a previous call in which I had raised concerns about testing supplies to the President, Vice President, and the administration, Montana did receive a shipment of 5,000 swabs and the viral transport media, which will be distributed to areas in need all throughout our state. During this entire pandemic, our state lab has been able to perform tests on a quick turnaround and on every test it receives to the lab. I've been encouraging doctors and healthcare providers over these past weeks to test every Montanan who's symptomatic, and I'll continue to do so. Starting this week, our state lab will have another platform side by side to existing machines, which will allow us to significantly increase testing capacity to almost double. There are currently 8 of the quick testing Abbott machines out in the communities, with another 7 on hand to be quickly deployed to fit any need. Now, we continue to work on obtaining test kits for those machines, which will assist hospitals, nursing homes, tribal communities, or others with providing quick results for those experiencing COVID-19 symptoms. But we're not out of the woods yet when it comes to tests and testing supplies. And like I have each and every day, we'll continue to ensure that we can make headway with the supplies to do further testing. So while we ask Montanans to continue looking out for their communities and the most vulnerable among them, we'll continue to build up our PPE supplies and testing capacity. In the event of additional cases in areas of the state, having that will allow us to act quickly, to isolate and quarantine impacted individuals, and prevent further spread. I'd also like to give a shout out to our local public health officers. They've done an incredible job with contact tracing. They've been quick in contacting positive cases and doing the work to ensure that those who've been in contact with positives are quarantined. If you look at Gallatin County as an example, the spread is slowing and almost all of their cases have reached the recovered status. I know that with that same diligence as we've seen all along in responding to this public health crisis, our local public health leaders will continue to guide their localities using data and science in making sound decisions in the interests of both the public's health and the economy. I know that this crisis has hurt and will continue to hurt Montanans financially. As governor for the past 7.5 years, I've worked hard to build up the economy and fought to get more money in the pockets of hardworking Montanans. And throughout the crisis, I've tried to provide economic stability to Montanans in every way, at least that I can, including rental assistance and easier access to unemployment insurance. As was announced yesterday, the Department of Labor and Industry has launched a new web portal to allow Montana's self-employed, gig workers, and independent contractors whose businesses have been impacted by COVID-19 to begin filing claims for pandemic unemployment assistance benefits. We certainly understand that this financial relief is much needed during this time, and we worked as quickly as possible to get this up and running for Montanans after finally receiving guidance from the federal government on this component of the CARES Act. Eligible claimants may receive payments backdated to the week of March 15th. And in addition to other Montanans currently receiving unemployment insurance, these workers will also be eligible for the additional $600 per week and will backdate those payments to the week ending April 4th. In the upcoming weeks and months, my administration and I will continue to provide relief to families that are suffering in this new normal. Well, the future of our nation's economy and our state looks very different today than it did 5 weeks ago. Yet my word that I'll continue to put the well-being of Montana first, continue to consult public health experts and business leaders, and use facts, not politics, to guide my directives. Finally, I'll continue to make decisions based on what's best for the state of Montana, best for Montana workers and businesses, and best for the future of Montana's children. So thank you for tuning in. Again, you can find Montana's plan to reopen. It looks something like that right here, as well as additional guidance to employers, individuals, schools, others at covid19.mt.gov. I'll now open up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand's raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Yeah, Governor, this is Troy Copley from the Montana Radio Company.
Hi, Troy.
You said when looking at moving from phase 1 to 2, there's no set timeline, but once we move into phase 2, how quick will the trigger be to take a step back if more cases start to appear?
Yeah, and first, Troy, that I hope that won't be a decision that we have to make. And I think that just as Montanans have taken this seriously over the last 5 or 6 weeks, I expect Montanans to do the same. And we will look at, this isn't just like a numbers based or time based. So we have to take a look at what exactly is happening. So I hope we all are responsible and make sure that we can stay in phase one at a statewide level and go to phase two. But that'll be informed by the data. It'll be informed by what's happening across our state. Like, this isn't just an aggregate numbers game. I expect folks in Billings, just like folks in Beaverhead County, to take this responsibly. And we'll be looking at the data and before we make any further decisions. Another phone question. Someone is unmuted. Next phone question. We just heard someone's voice.
Hello, Eric Teacher with the Montana Food Desk here. So one thing, looking at the details of your order and comparing it, it looks like it follows the framework that the White House laid out last week pretty closely, with a couple exceptions. One of those is that the White House framework doesn't have bars in the first phase. Looks like they're planning to keep those closed until, at least those guidelines will keep them closed until the second phase. So I want to ask why the difference here, like particularly when we're keeping gyms closed in the first phase.
Yeah. And thanks for the question, Eric. I mean, if you look at what we've put together, it wasn't modeled off of, in any of respects, necessarily off of just what was put out last Thursday. And we've been working on that even before. And from that perspective, in talking to our health experts and talking to business, we said, what's the best way to go? And, you know, there are different facets than what was outlined by the president last Thursday, and I imagine there'll be different facets going into phase two and phase three. We tried to look at the best ways to be most protective of public health, but also start to unleash our economy. Another phone question.
Oh, hey, this is Holly. Can you hear me?
Sure can, Holly.
Awesome. So I'm wondering if you could sort of walk me through sort of the main drivers behind taking that step now. You know, understanding that we've met the metrics that you laid out last week that you wanted to see, but I wanted to just hear more about, you know, why we're doing this. Is it economic pressures? Is it that you're hearing from schools or public health officials? And sort of what are the reasons beyond just needing these metrics? And then also, you know, understanding we wouldn't be taking these steps if you didn't feel that testing capacity was sufficient. But sort of talking about what that looks like on the ground, does that mean you feel like if a nursing home in Billings has someone who's symptomatic that can test everybody and employees quickly, and sort of how that looks, you know, understanding that people can be asymptomatic or not, you develop symptoms for 2 weeks, so we could be, you know, that leg of catching an outbreak, just sort of how your comfort level is around understanding all of that, the science behind it, but then taking the steps we are today.
So I think that the first question was, why now? And I recognize that there are some folks in our state that would love to keep everything shut down until there's a vaccine or until the virus goes away. But the why now is because Montanans can take their own pride in what Montanans as a community have done together. I mean, we are literally the lowest in the nation when it comes to hospitalizations and positive tests per capita. And that's the case because we acted both aggressively and we acted collectively, meaning that Montanans all across the state took this seriously. So I know that Montanans are hurting. I do know that we need to figure out ways to get to what a new normal might look like. And these are those measured steps to do so. So it is both looking at our health numbers, it's looking at what our capacity is out there, it's looking at our economic numbers, it's recognizing that we've taken good steps, significant steps over the last 5 or 6 weeks to get us to the point where today we can actually see not necessarily the light at the end of the tunnel, because as I noted, that the tunnel may well end up, or that light may not fully be for Montana or any other state until a vaccine or other things occur. But there's reason for that optimism because of what Montanans have done. To your next question of testing and capacity, I think your example was, let's say that there were positive cases in a nursing home. Does that mean we have the capacity to test everyone in the nursing home, or what do we do with the fact that there could be asymptomatic carriers? Will every asymptomatic carrier, potential carrier, be tested? I mean, that would indeed mean that we'd have to test literally everyone in the state from that perspective. And I think that this will be a continuing, just as we have for the last 5, 6 weeks, working with not just at the state level, but working then with our local providers, our local public health, our doctors, to say, how do we best address any hotspots and flare-ups that occur? As we get to even more rapid testing, hopefully, that's one of the reasons, like we're looking at the potential for strike teams, we're looking at other things along the way to try to address some of these flare-ups and challenges. And just as Montanans shouldn't like say, mission accomplished, there's nobody at the state level at this point that's saying mission accomplished. What they're saying is we're now entering into a different phase that also brings in a different, unique set of challenges. And we'll all do all we can to be not just responsive to those challenges, but contemplative of what those challenges might be before they happen.
Governor, Jeremy Schnell, ABC Fox. You mentioned in your opening statement about schools and how local school boards, each of them will be making their own decisions as this directive moves forward. But for the fall, as you were speaking about how the cases may, continue going to the fall, will they be making their own decisions for then, or will that be something that's...
Yeah. And so what the directive did is that typically a decision to close the school district, as an example, and the control over that school district, while there's guidance from the Board of Public Education and the legislature, that's made at the local level. And what the directive that I did is took that away and said, at this point, for this period of time, all schools are closed. What we do 2 weeks from today is return it to that local school district to make that determination, that locally elected school board, to say, how should we provide instruction for our kids through the rest of the school year? And directly the question of, well, does that stay the same next fall? I sure as heck hope so. Meaning that the only way that would be otherwise is if next fall we're in the same position that we were 5 weeks ago, where I had to do a statewide directive closing schools.
One more question.
Sure.
Obviously, the protests from this weekend, are you concerned at all about people being in close proximity like that and uptick in cases?
I'm concerned whenever social distancing protocols aren't followed. And I'm concerned as we start to reopen up things, and I think all Montana should know, we'll probably see additional cases. So from that perspective, yeah, I always have concerns when we're aggregating large groups of people that transmission might occur, because that's where we saw a lot of community spread. Other questions?
Governor Bullock, John Riley with Montana Television Network. You mentioned that the travel ban will stay in effect. How long will it stay in effect, and what are some of the qualifications for removing that travel ban?
Yeah, and thanks for the question, John. I mean, what we have to do is see what's happening on the ground in Montana. I mean, it's that simple. It's sort of like weeks ago you were saying, well, how long are these directives going to be in place? Montanans worked hard so we could get to this point where we start lifting them. And we want to make sure that as we go forward, we're looking at what's happening on the ground and figuring out then when is the best to lift that. But for now, it is still in place. Phone question.
Hi, this is Nikki Willett with Yellowstone Public Radio. Thanks so much for holding the call today. Looking through your guidance, phase 3 still has people changing how they interact with groups and continued physical distancing. Do you expect that there's going to be permanent changes coming out of this? Like, will we always be standing 6 feet apart?
I sure hope not, Nikki.
Same.
But I think that, look, you know, I think over the last 5 weeks, I've said things like this is a dynamic and rapidly changing situation more than I ever could have imagined in my lifetime. And it has been. And I mean, we still don't know everything about how this virus is going to act. So as I try to lay out, even beyond phase 1, what we should be looking at going into the future, we collectively, and we that, you know, have been spending a lot of time on this, and it's not just with those behind me, it's also pulling in people from around the state, actually, to be honest, as they worked on from a public health side, from a medical side, from a business side. We've tried to give the best guidelines of what a phase 2 and a phase 3 might look at. But note, please, that none of this is carved in stone. None of it is, in as much as what we have to do collectively is see what's happening in our state on the ground. So a long way to say that, no, it could be a while that I'm still encouraging people to wear face coverings in larger groups. But we just have to see what happens. Another phone question.
Hi, Governor. This is Corey Cates-Carney with Montana Public Radio.
Hey, Corey.
Hi, Governor. With businesses being instructed through these phases to implement a suite of new protocols on more cleaning, possibly conducting health assessments, temperature checks at the start of shifts, wondering if there's going to be training or funding. Will the state help supply equipment like thermometers or PPE or other items when it seems like there's problems for, shortage of that nationwide in the state already, but if businesses are now required to have more of that as people go back to work, what's that going to look like?
Yeah, I think, Corin, first of all, so from a guidance perspective and an assistance perspective, not only within the directives do we have some of the general guidelines, but anticipate, and that's one of the reasons for those places that could actually have more people coming through them, that we've given a bit more time for local public health to actually be partners as people look at how to reopen and reopen right. And we want to see what's happened along the ground. I mean, look, for 2 weeks, I think it was about 2 weeks ago, and we said, well, I'd like to get 5, we placed an order and working on orders for multiple thousands of thermometers, just like we've been working to try to get PPE and other things for our healthcare providers. And I think we just have to assess what's on the ground and see where that states, DES, Disaster Emergency Services offices and others can provide assistance.
Governor Bullock, this is Madison Donor with NBC Montana KECI. I'm just wondering when you touched about visitations to nursing homes and senior living facilities, but what about hospitals, protocols for local county hospitals? Will those continue to remain the same? Have you been in touch with hospitals about how their visitations or how when they'll return to a normal state?
Thanks. And thanks for the question. I've not had discussions with sort of the local hospitals as far as what they're doing along the way, meaning that I'm in regular conversations with Montana Hospital Association. Last night I was on a call with many of the chief medical officers and others in hospitals. But I think that the hospitals will continue to both guide from the perspective of how do they keep their patients safe, how do they keep their workers safe, and also how can they be prepared for surges of COVID-19. You note that, as but one example, I never banned elective surgeries, but hospitals actually working together had stopped those for a while. And I anticipate the close partnership that we've had all through this last 7 or 8 weeks with our hospitals and making decisions collaboratively, not by directives. Another phone question.
Hi, this is Phil from the Tribune.
Hey, Phil.
Just wondering, there's been, I believe, 4 deaths reported this week. Does that all give you pause about moving forward with the reopening? Do you think, the worst is yet to come, or, is that part of the equation?
Phil, I think that, and I mean, I would note that we've now had 14 deaths in Montana. And I don't think I'm unique or different in taking every one of those as a personal loss and a collective loss for our state. And I mean, my family, each time as we gather and say what we're thankful for and who we're praying for before dinner when I'm home, I mean, each time that knowing that families are impacted have been part of what our family personally does. And I do think that the possibility and the likelihood that, unfortunately, this virus will take other people's lives going forward is certainly the case. It did not necessarily, that's part of, hospitalizations, positive tests, infrastructure on the ground, meaning how's our healthcare community doing, is all part of what we looked at in closing and in opening. But I would say it does underscore the importance of all of our continued vigilance when it comes to those that are most vulnerable, because the vast majority of those that we've lost in Montana are our legacy Montanans, our older Montanans, and those that are most vulnerable. Another phone question.
Hi, Governor. This is Colin Geiser from the Daily Interlight. This is not necessarily in your jurisdiction, but I am wondering about opening of national parks. Senator James, Congressman Ian Forte both talked about how that's going to be up to the gateway communities like Gardner, West Yellowstone, Kalispell. I'm wondering if you are in any communication with those gateway communities, what your say is going to be in that department, and whether, and I guess your thoughts on the safety of opening up national parks.
Yeah, and I've had conversations with both superintendents of our national parks, have had some discussions with individuals in gateway communities, and certainly hope and trust that our federal partners will work in conjunction with our efforts at the state level and at the local and community level. So from that perspective, like is but one example, right? We're still keeping our out-of-state, non-business travel 14-day quarantine in place. And certainly understand and expect that our federal partners in the Park Service respect and work with us as we work through these phases going forward. Another phone question.
Hi, Governor Bullock. This is Jonathan Henniger from Montana Free Press. I was just wondering if opening up the economy would encourage more people like tourists to come here, and how realistic it is to expect tourists to not come here during this time.
Yeah, well, I think, Jonathan, there's no place better, as we all know, than springtime in Montana. And we're still going to be discouraging and asking individuals to quarantine. Just as how realistic is it that Montanans follow the social distancing, that follow the directives that we've had? By and large, I've been so pleased with how seriously that Montanans have taken it. And I certainly hope that others thinking about coming to Montana will take it equally seriously. Another phone question.
Good afternoon, Governor. Chris Peterson from Resource News. Private RV campgrounds, that kind of thing, how should they handle it?
So private RV campgrounds have had the opportunity to still, I think, remain open even through the directive. And I think that just like every business should follow the guidance through phase one, that essential and what were called, for the lack of the better word in the earlier directives, non-essential businesses should do the same. So would expect and hope that private campgrounds are working on sanitation, are working on the social distancing, are working on everything that we can to slow the spread or make sure that we don't end up with clusters. Another phone question.
Governor, this is Tristan Scott from the Flathead Beacon. I'm wondering, as school districts consider whether or not to reopen, what sort of considerations should they be giving to teachers and students whose families are from at-risk populations? You know, what happens if schools open and teachers aren't comfortable working or can't work because they're part of a vulnerable population? Do they get paid? You know, I know that your packet on the phased-in reopening paid consideration to that, but I'm just wondering if you've had conversations with school districts, because I'm sure that's going to come up across the state.
Yet, Tristan, we did put out in the school reopening considerations matters too that I think schools should think about as they're reopening. And again, looking at ways to recognize that in a new normal, to unleash their creativity in doing so. But we've always been a local control state, and what I'm providing the assurance is at the state level, the state funding will continue, and I have no doubt that, you know, both local school districts can certainly be working with their local public health officers, but as we get additional guidance and good ideas, because often, and we see this all the time, that the good ideas and the creative ideas aren't always top down. They're actually coming from all across the state. So we'll share information that we get along the way as well. Another phone question.
Hi, Governor. It's Marisa Giorgio with NBC Montana, and I'm wondering what other things you'll be watching for in phase one that might signal we might need to pull back.
Yeah, and Marisa, I certainly hope that we don't end up pulling back, at least from a statewide perspective, from a phase one. meaning that there are the possibilities that if cases are substantially spiking in one area, that local public health officials could make the determination that, well, maybe that area is moving a little too fast, too far. And I'm counting on Montanans, as I've been incredibly inspired by them to date, to continue to do as much as possible. So just as, and again, the questions from weeks ago were, when can we expect certain things? I mean, we'll continue to be monitoring all the data, and we'll continue to be working with our local health officials, but I'm hopeful that we don't end up taking steps back, especially at a statewide level. And I think that we have both the understanding of the business community, we have hopefully the understanding of individuals, and we have the efforts with local public health and at the state level to make it so that the infrastructure is there so we don't have to take steps back. Does that mean that there won't be any additional cases? No, there will be additional cases, but it's how we collectively manage this that'll keep us from taking steps back from phase one, and it's how we manage this collectively and individually that'll get us to the further phases as well. Another phone question.
Hi, Governor, this is Amy Hansen with the Associated Press.
Hi, Amy.
Hi, I had a couple questions. I don't know, like, there are governors who've just closed schools for the rest of the year. Does it make sense to open things up and sort of risk this for maybe another month of school? And do you expect, I guess, differences between larger areas and rural areas on that?
So does the local control make sense? Do I expect differences between larger and urban areas? I think every local school board should try to decide what is best. But I also think that, period, they should decide what's best. And I think that should be with the calculation overall of, as I noted in my comments, like I have yet to hear from a teacher that says this is as good as in-school learning. And I recognize that what our efforts are going to be doing, just as we're opening up businesses, is to minimize risk, not to completely eliminate risk. And I think that, I mean, for goodness sakes, as we took action at the same time as California did to close their schools, when we look at our caseload, a dozen have been 19 and under. That these are all things that local school districts should be thinking about. And at times you can think about our at-risk kids versus other kids. At times you can take a look at, unleash that creativity along the way. And to the extent that folks want to, that we'll be partners in that. Another phone question.
Thank you, Governor. This is Tom Schultz from Voices of Montana. I'm wondering if in your discussions with business leaders that they've expressed some labor shortages. I know that I heard that because there's some concern the extra unemployment may create a disincentive for their workers to come back. I don't know if it's too early to tell if that's an actual problem or not, but have you guys talked about proposals at the state level that might be able to remedy that?
Tom, I think there is incredible dignity in work, and I think that the literally tens of thousands of Montanans who've become unemployed because of COVID-19, just like in every corner of this country, would sure as heck much rather be at the job site or at their office and working. So one of the reasons why, as an example, in the food services industry, that we gave a little bit extra time was for those employers that need to get their workforce back. And I think that we'll continue to certainly be keeping an eye on things, but look, before this happened, one of our state's biggest challenges was a lack of a labor shortage, meaning we had more good jobs available than we had workers to do it. And I think where we are right now is that we have a lot of workers that are excited about the possibility and the prospects of getting back to work, and will be doing so. Final question.
Hi, this is Eric Gill with the Sydney Herald.
Hey, Eric.
How will these guidelines and restrictions be enforced if violations occur?
Well, I think, so the question was, how will the guidelines be enforced if violations occur? And it's the same as how the directives were in place and enforced. First and foremost, I expect Montanans to be self-enforcing. I expect Montana businesses to take those steps along the way, just as they were under the directives that we had. It does vest, just like the directives did, local jurisdictions with the authority to enforce these public health orders, though. All set? I'll close again by thanking Montanans. I know that certainly in the position I hold, but also as a community member and as a parent and as someone that talks to a lot of people across the state, that this has been, and in many respects will continue to be, a difficult time for us. And I recognize that difficulty, but I also am inspired by how Montanans have treated this as a community. And we really have come together to address something that really has changed sort of what normal is and used to be for all of us. So that I encourage continued vigilance and continued efforts. This is no time to spike the football. We can take a moment's pause and say, you know, lowest positive cases per capita, lowest hospitalizations. That didn't happen by accident, and that's not for nothing. So take that pause, but continue to say that every action that I as individuals and businesses take are not only important for my employees or my customers, but important for all of Montana. And thanks for all your efforts to date, and thanks for all you'll be doing going into the future.